Hi, Health Source of Mount Pleasant followers, it's Dr. Brunner, and welcome back to Mobility Monday. Today we're going to go over prescription 12, which is over the lower leg, which is the calf and the shin. So it is a great mobilization to help improve plantar fasciitis, collapsed arches, ankle, knee, foot pain, even any calf stiffness that you have after running or any workout. So I'm going to demo some mobilizations next. The first mobilization is the calf mobilization. So we're going to utilize the foam roller and also the small mobility ball. We're going to start at the intersection right above where the Achilles kind of meshes with the two muscles of the calf. We're going to start from there and working up to right behind the knee. And we're going to roll with the orientation of the fibers, going up and down. And we're just surveying that tissue. You find any tight or restricted tender tissue, then you can relax right on there for about 10 seconds. You can put some overpressure too, get a little bit deeper into that tissue. Also oscillate side to side while breathing, keep a nice neutral spine here. We'll also bring in some movement at the ankle to help floss or get those matted tissues to slide better between those layers. The next mobilization is a piggyback off of the foam roller mobilization for the posterior calf. We can use a small mobility ball, and just like we did with the foam roller, we're going to get a little more pinpoint with the trigger point areas of the calf. We're having some issues there with some tightness or stiffness. So same rules apply, putting that in an area that is restricted and flossing or moving that ankle, getting that relative slide and glide, those calf tissues. And that's for the posterior aspect of the calf. We're going to do the same thing on the lateral side, going right from that bony prominence of the fibular head down to the lateral malleolus, and you can track all the way up and down through there. We're also going to do the same thing on the medial side. So going for the lateral, I'm going to place it up top right below that bony prominence. And again, bringing that foot up and down, getting that moving better, and then even oscillating side to side. That can be pretty tender and tight. And same rules apply. We go to the medial side. We're going to go right in off of the tibia there, working our way up to the knee, down to the medial malleolus. We're going to start here. I'm going to wind up that ball and that tissue, put pressure there, and then we can move that foot and ankle up and down, flexion extension, to get better movement, and working your way down even without any movement, just pressure alone, just creating that trigger point therapy, and that compression helps loosen up those tissues. And we do that for both legs, about a minute at each aspect of the calf. And lastly is the shin mobilization. So on the lateral side, the front aspect, right off of the bony prominence here, off that ridge, we're going to mobilize up and down through there. For people who get shin splints or any issues with calf as well, we got to loosen up the anterior side, not just the posterior. So we're going to take the small mobility ball, we're going to place it up top, and we're going to go up and down, checking out that tissue, seeing what's tight and restricted. For me, it's up top today. And again, we're going to flex and extend that foot, bringing up all that tissue, oscillating side to side, going to cross those fibers. And lastly, leaning over, getting a little bit more pressure into that tissue, and coming off, and then contracting, bringing that ankle and foot in dorsiflexion, tightening that tissue, and then relaxing and sinking even further into that tissue over the ball. Going about a minute to 2 minutes on either side, working your way up and down. Thank you for watching prescription 12 over the lower leg, the calf, and the shin. Next week for Mobility Monday, I'm going to cover Prescription 13, which is our last prescription as a part of this series, and it's going to be covering the ankle, foot, and toes. So I hope you guys have a great week.